Hello, doctor.
Hi.
So, ma'am, you said you treat for heart failures. So, how do you analyze the improvement in heart failure patients?
Normally, as I told you, before treatment and after treatment, I'll take the echo and ECG and all other blood reports and all. After they admit in the hospital, after they come out from the CCU, I'll tell them to take one more echo. Then that time, when we get the heart attack, always the heart function will be very low when we take the echo, because the echo is full water on nearby the chest. So when we take the echo, the result won't be perfect. So after they come out from I'll tell them to take one more echo to estimate how much the heart function is. If it shows 20% after the treatment, it will come to 35 and all. After the allopathy, that's not from 20 it is coming to 35, it's actual 35% because there is no water, because they give diuretics as a treatment. After that, I'll tell them to take the echo, then I'll give the treatment for 50 days. Each course will be 50 days. In 50 days, I have some regimes. There is no food restriction, but movement restriction. I'll tell the patient. Then I'll tell them to take after 50 days, I'll tell them to go and check with the doctor, their cardiologist only, or another cardiologist. Take the echo and ECG. Then what is the improvement? According to that, I'll continue the treatment. We need the treatment more time, but the life-threatening time is 50 days. Within 8 to 21 days, symptomatically the patient will be improved. The patient with lot of swelling all over the body, more than the leg region, then the kidney and liver failure, along with that they come. Then they won't not able to take food, they won't be able to read and walk and do and lay down, sleeping and all difficulties. All that is their symptoms. That and all will reduce within 8 to 21 days. After that, if they continue the treatment, in the 50 days, definitely more, like 95% of the patients get the result in the echo, improved result. Like the size of the heart reduces, then the pumping may improve to 10 to 15. If it is 35, it may come to 40, 45. That depends. If the patient come within 6 months or 1 year after heart attack and all, they get faster result than the patient who come after 4 years, 7 years, and 1, 2, 4, 5. Some patients get after first attack, they get 48, then again it is 40, 30. Like they keep on get the heart attack, then they come, there will be more dangerously affect the conduction system. That time, it takes time, otherwise we get very faster result. Heart function is above 35. Then if there is no standing, the patient with standing, that means if the patient put the heart stand after heart attack, before that if you put, there is no problem. If you continue the medication, no problem. But after heart attack, if you put the standing, there is high chance of dilation of the heart and heart function again come down. It come to total failure, even biventricular failure we can expect. So, not such patients, but all other patients, the result will be very fast. Sometimes the patients come with 10% ejection fraction, with right heart base is 7. All that is very, very dangerous. That time liver, kidney, all that will be failure. For them, for making it symptomatically improved within 21 days will take. That and all is recently if they are getting. Otherwise, I don't know if they are keeping it like that and for 4 or 5 years they are coming and in the last stage and all, it will be in a 70-30 ratio result. But most of the patients, if it is 20 and all, if it is 10%, most of the patients get in the first course itself, their right heart will be improved and left heart will come to 20-25 like that. Then they have to continue the treatment up to ECG become normal. This is the specialty here. We can make the heart function little bit improved also, but ECG making it okay is very difficult. That also I'll do it, not everybody. Some patients I'll tell directly it's very difficult. The condition is totally gone. It will take so much time. I could able to maintain you. There is a lot of patients who is still continuing in 7 years. Because that their condition is totally damaged. To them, I cannot say anything. After each course, 1 or 2 courses, I keep on tell the patient to take the echo and ECG by going to the cardiologist, and according to the improvement, we'll continue and after the patient reached, there is no DCM, dilated cardiomyopathy, the reverse cardiomyopathy, there is no heart failure. Even we get RWM, there is no regional wall motion abnormality, no sign of heart attack. Such type of echo also we get. Then then I tell them to stop my treatment, but let them always, if they are not put the stent, even they can stop the allopathy medicines also. Up to my treatment is not over, up to that I'll tell them to continue the diuretics, whatever doctor is prescribing. Only with the help of allopathy doctor we can do the treatment.